Thank you for watching On Call for All Kids. Today we're talking about COVID-19 concerns and heading back to school. We'll discuss how COVID is currently affecting kids, where we stand with kids and vaccinations, and how to best protect our children this school year. I am joined by Dr. Allison Messina. She is the Chief of the Division of Infectious Diseases here at Johns Hopkins All Children's Hospital. Great to see you, Dr. Messina.
Thank you. It's good to be here.
Well, it's a tricky time because school is just around the corner, but at the same time, we're also seeing an uptick in COVID cases. What are we seeing currently here at the hospital?
Yeah, so unfortunately, we are seeing quite a rise in our COVID-19 cases here in the hospital in the month of July. After a very nice June, we're now seeing a rise, as are other states across the nation.
And we're also hearing about this new Delta variant. What do we need to know about that?
So the Delta variant is much more contagious than the variants prior. And what that means is that it's easier to spread from one person to the next.
So we know that getting the vaccination is going to be our best bet of protecting not only ourselves, but our family as well from getting COVID-19. Where do we stand as far as kids and vaccines go?
So we do have vaccines available for people 12 and over. So if your child is 12 or older than that, your child is eligible to get the Pfizer vaccine. Now, the Pfizer vaccine is given in a 2-dose series. You get one the first day and then one 3 weeks later. So school is starting pretty soon. So now would be the time, if you are still thinking about getting your child vaccinated, to do it for maximal protection. Typically, you develop immunity about 2 weeks after that second dose of vaccine. Now, for those under the age of 12, there is not yet a vaccine available, but all of the companies that are making these vaccines are working on getting a vaccination approved under the age of 12. And we hope to hear more about that from those companies soon.
So we know in the meantime, there's a large population of our school-age children that just cannot get vaccinated yet. What can we do as parents to help keep our kids safe?
Right. That is the big question. I think that we do have a few things that we can do to keep kids safe. Number one is masking. The AAP just came out with a recommendation that they recommend that all kids that are learning in school wear a mask. And what that does is it just reduces the chance that if somebody were to have the virus, it would reduce the chance of them spreading it to the next person. And that's always a great idea. The other thing that we can do for our children is to make sure that children aren't going to school when they're sick. If your child has respiratory symptoms, such as cold symptoms, see your pediatrician or call your pediatrician and see if they might need to be tested, because it's very difficult to tell the difference between a cold and COVID, especially in younger kids. The symptoms are very, very similar.
Are there any other steps that parents can take to help keep their kids happy and healthy as they embark on this new school year?
Yes, absolutely. The other thing I want to mention is it is still important that kids are up to date on all of their vaccines. So even if your child is too young to get the COVID vaccine, your child should have their flu vaccine and all of their other vaccines for school. The other thing that parents can do as well is, if there are members of the household, such as the parents or maybe even older siblings who are eligible to be vaccinated, to get everyone around the younger kids vaccinated. That really helps too, because a lot of times kids get sick from their family members. It makes sense. Their family members are the people that they're around most of the time. So in this way, we can kind of cocoon them in that sense.
Well, Dr. Messina, thank you so much for joining us and for all you have been doing throughout this pandemic.
Thank you.
We hope you have a very safe and happy start to your school year. Don't forget, you can also visit our website. It's hopkinsallchildrens.org/newsroom. You'll find a lot of great topics in pediatric healthcare and other great resources for your family. We'll see you next week.